All right, today I will be interviewing Dr. Kevin Pierce. Doctor, thank you for meeting with me today. I know you had a busy weekend full of lectures, so I appreciate you taking the time out to meet with me. What is your professional title?
Senior High Performance Healthcare Provider, Doctor of Chiropractic in the United States.
Wow, that's impressive. So that would be your organization affiliation, or?
Correct, yeah. So I'm affiliated with the United States Olympic Committee. I'm also affiliated with the American Chiropractic Board of Sports Physicians and faculty at Southern California University of Health Sciences.
What initially led you to be interested in the field of chiropractic?
I believe it was the initial relationship with a colleague of ours now, Dr. Collins, and relationship with him, and really just opening our eyes to healthcare from a different perspective of alternative medicine.
I would like to go into the physical therapy field, but with a sports medicine specialty or focus. And I know that that's what you do with the Olympic team. You're really involved with the athletes and things of that nature. So was that something that when you started chiropractic school that you were interested in, or is it something that kind of through the ways of it just presented itself and then you began to pursue it?
Yes, I was always interested in the athletic side of things, being an athlete myself, going through injuries and illness. The sports med side always kind of interested me. As I was in chiropractic school, realized there's an opportunity for a sports med specialty, and there's a track with an internship and then a potential residency in sports medicine, which might lead to a further career in sports med. So it kind of just arose on itself as I discovered it through school and different injury council meetings and things of that sort, that it was an opportunity for me to pursue.
I wonder if that would be kind of the same thing for me as I get into the physical therapy program. It's now a doctorate of physical therapy, and if they open that door to allow students to kind of funnel into a direction to go that way, it might kind of play out the same way.
Yeah,
probably not for the Olympic team, but
it might. We have a lot of providers all over. So
yeah, I would love to do like a professional athletes or something of that nature.
Yeah.
A little bit higher level, with athletes who are really wanting to come to work because that's their job.
Sure.
They want to work on their own health and fitness and get better. So I think that would be pretty good. So the next one's a two-part question. Did your university offer any job placement? And then besides that, what was the process for you to be hired by the Olympic team?
So there wasn't really a job placement. I was fortunate to have a 2-year residency in sports med, which kind of catapulted me toward the sports med field in the Olympic realm. And so there wasn't really necessarily a job placement. Traditionally, people would go into private practice or a group practice or something of that sort. So there wasn't necessarily a job placement itself. The process of me being hired by the U.S. Olympic Committee was quite lengthy. There was a number of interviews. Interviews were the biggest piece, but the precursors to those were just having specialty in sports medicine. There's 2 separate sports specialties in chiropractic that needed to be obtained, and then having years of experience in practice with elite level athletes of different calibers, so both elite level plus professional, and a number of those things kind of checked off the list through my residency training, and then also with my international travel, having been a part of numerous Olympic caliber events, really opened the door for the opportunity to join the Olympic Committee.
You have to every year acquire units or hours in your profession.
Sure.
What additional education are you required to do each year?
Each year, like most professions in the medical field, you have to pursue continuing education hours to maintain licensure in your state. Those can be things from radiology to technique to ethics. A variety of topics need to be covered in order to maintain your licensure through the state of California and then nationally. There's opportunity to be a part and affiliated with other organizations, something similar to the American Chiropractic Board of Sports Physicians, where you can attain hours through exam committees and different things to grow the success of a profession. So that's opportunity where you can actually gain hours doing that same thing. But the majority of it's done with through continuing education.
And does any of that include writing papers or being involved in studies, or is that just something that's extra and you do that additionally to basically be at the top of your game to
Right.
offer the best to your patients or clients?
Yeah, sometimes depending on what type of study you might be a part of, you can gain hours with that, or but the majority of it's to further your profession and the knowledge that either your profession and healthcare itself has. So majority of that's just additional work to stay at the top of your game, if you will, and keep others informed that something new technique-wise and or a study retrospectively might be a part of a game-changing modality or something similar.
Is that something that's changed kind of through your process or through the years that you've been involved, where you're always, this is how we used to do it? You know, CPR always, you know, changes from you know, mouth, no mouth, this. What has been like a big thing that's changed, or is there nothing that really just stands out?
No, everything continually changes. I think each year and each month, really, when new articles are published, new things are discovered, and they're more current than text is. There's always new developments when it comes to what the new edge of therapy might be, and or recovery services or things like that when it comes to post-op ACL as an example, kind of management plan and how you might consider the etiology of an injury and the progression of how you rehab someone back or something similar. So it's always progressing, and if you're not progressing, you're dating yourself.
Yeah, getting left behind.
Sure.
What would you say is the most either enjoyable, rewarding, or even difficult part of your profession?
I think from our profession or from a job's perspective.
Either individually or profession. I mean, could be law,
Yeah.
the law side of it, the enjoyment of dealing with athletes.
Yeah.
Any
I
of
think
that.
difficulty is just going to be the health. It's a healthcare field. It's alternative medicine, so you might be looked at differently than other professions. But if you stay on top of your game, you're well read, and you stay current, and you continue to push yourself. So I think that's something that's extremely rewarding when you see the outcome of that. I think another thing that's rewarding is the outcomes with patients that you work with and their success through maybe just something you were able to help them through, a difficult time, a difficult injury, something else similar. That's probably the most rewarding piece.
So that takes me into my next question is, has there been an athlete that you really had a hands-on experience with that had a difficult injury, probably shouldn't have come back, but you had a part in their story and getting them back on track to be at the caliber of athleticism that they were before they were injured?
Yeah, sure. I think there's probably quite a few in my tenure of my career itself. There's a number of athletes who have a lot with traumatic sports, and I think specifically on the Olympic side where we have a BMX athlete with a significant crash with a number of injuries when it came to bilateral first rib fractures, bilateral pneumothorax, multiple compression fractures in the spine, missing some teeth, concussion, as well as a dislocated shoulder and a repair that was needed. So all those injuries sustained at one traumatic event, and it was 4 months before the Olympic trials. So rehabbing someone back and being a part of a team that helped an athlete make it to trials, didn't make the Olympic team, but to be able to ride at an Olympic trials event with the hopes if you won that event, you can still go to the Olympic Games. So a big, huge success story with a lot of hours, a lot of man work, not just myself, a team around us that helped facilitate this individual athlete's career and gave an opportunity.
Wow.
Quite rewarding. Yeah.
Yeah, I would bet. What qualities or qualifications would you look for if you were hiring somebody to not so much replace you, but to be in the same field as you? What would be those qualities that you would look for?
I think one of the biggest qualities would be someone who's always willing to learn, not settling with an outcome as just good, someone that's driven, well-read, educated, extremely personable with a great bedside manner. Would be quite a few of the attributes we look for someone that can handle a caliber of athlete and or the day-to-day of dealing with athletes themselves when it comes to needing a support system, someone who's personable.
Yeah, and I would imagine it's probably a pretty big thing with, client confidentiality, not being able to say things, or especially the type of people that you're dealing with,
Sure.
type of athletes you're dealing with, the names that people might know, to say, like you referred to a BMX athlete where you didn't put his name out there. So I imagine
Right.
that's probably pretty big.
Yeah.
Pretty big.
So a lot of the times they're competing within the U.S., so we're pretty good.
Yeah.
And so maybe our biggest competition might be the person sitting on the table next to them. So
Right.
there's quite a bit of patient confidentiality and some HIPAA laws and some things that we need to maintain in order to protect everyone's health records.
Sure.
Yeah.
Well, I brought my a resume and cover letter.
Great.
So if you could, if I was seeking a position in your firm, I'd like to see if you could ask me a few questions, see if I could answer them. If you would take a second to maybe look over my cover letter and resume, and maybe just ask me a couple of questions that come to mind.
I think having this ahead of time, it looks like you're pursuing the Doctor of Physiotherapy degree. So what really interests you in pursuing this field of healthcare would be the first thing I'd ask.
Well, what you had said is the relationship that you built with somebody you were able to go into at a younger age, and now he's in the field, so you guys are basically partners, if you will, in the sense that you guys work together. When I was a senior in high school, going into my senior year playing football, I had a knee injury, and Dr. Dennis Rohrig helped me get through that injury in what they said could be up to 6 weeks. Got back in 3 weeks, was able to play my senior year, received a scholarship because of what I was able to do then, and so ever since then, that was a main thing. Like, I want to help athletes who have a drive, have a desire to go do something better than what they're currently at, and without him, I couldn't have done it, and so I'd like to be part of somebody else's story to allow them to move on and do something better.
Sure, it's exciting. So what schools, you mentioned like I'm looking at your cover letter here first, you said USC as an option, Western Health Sciences as another option. What is, if both options presented themselves, how would you decide which one might be best fit for you?
Location would probably be the best. Having a family, having 3 young children, I still want to be able to be involved. The one being in Pomona, the other one being in LA. It's about a 45-minute difference, both ways. So, an hour and a half every day would be a big deal. But as far as, I know that both are good schools. USC sounds a lot, better, pretty prestigious to add that to your name. So I think that if I had a choice, I would choose USC. But I think the more logical and mature choice for me at the current position in my life is to go with the Western in Pomona.
Can you, I'm looking at a number of things as far as experience themselves and undergrad degree at West Virginia State College. More importantly, the time spent as a business owner itself, and maybe how that will set you up for success, or maybe you can highlight some of the experiences you had there that might push you forward and drive you in your career itself.
Well, being a business owner, especially being 3rd generation, I followed my father and his father, so my grandfather. I followed them, and they set a bar that I always tried to either obtain at the least and exceed. And so when I would have clients in, that's the most important person of the day, of the week.
Sure.
You treat them like they're your only client, your only person you're going to be dealing with at all. And when they're satisfied, they've got a good product, then you can send them off and know that they're not coming back unless they want to order something else. And so with fabrication, it's different than with actually dealing with somebody who has an injury. But at the same time, either way, if either a client or a customer feels like you're giving them everything that you have, the best of your ability, the best of your knowledge, ample time, then they're going to feel comfortable in knowing that they're getting the best of you and the best quality treatment. And so I think that that's what would help me carry into a medical field.
Nice. Most definitely. That passion, I think you describe as far as the ownership, that as a candidate we're looking for is always someone who's passionate about their work, driven at something, and I think long-standing since '96.
Yeah.
To present day. Definitely for the long haul. Healthcare itself isn't always rewarding. It's quite busy. It sounds like you'd be fit for it. I guess another thing I would ask is, can you highlight maybe just a little bit your the facility you had back to the YMCA and how that might help map your career moving forward?
We dealt with a lot of different age groups, from young kids all the way up to people in their 80s, early 90s. So I think having seen all the sides of it, physical therapy is necessary throughout those age groups. Specifically for the sports side of it, there's a lot of enjoyment in dealing with high-level athletes, or even just high school athletes who are driven to do something. So I think that I would take from that experience in the YMCA and seeing all those things. I wouldn't necessarily want to be on either side of the spectrum, but I'd like to be right in the middle of it, right with the athlete who is at the peak of their performance and their careers and things like that. So learning those things kind of helps to more focus where I would like to go, what I would like to do.
Yeah, it sounds like your previous experience with injuries and a good relationship with the provider that helped you would probably be one of those things that would catapult you forward as well.
Yeah. Yes.
I don't know that I have any more questions currently from what I see here, but
So is there anything that you could relay back to me of give me some help to either improve, whether it be my cover letter, resume, or the answers to the questions that I provided to you?
I think the answers themselves, I wouldn't change anything. I think they're raw, they're real. It's really important that you have true to yourself, and it sounds like that, so I wouldn't change any of those by any means at all. I feel that there's maybe some more experience that you have in there. But you have such a, I missed, you said athletes drove you to college. I think you might want to highlight some of the things that you have as far as your experience with the athletic side of that career that you've moved on from. I think that's something that would be ideal to have on this. You mentioned obviously high school and college, but I think there's probably some significant pieces of that undergraduate degree and your time spent there that could be highlighted in your and set yourself through the athletic side much more. I don't really know what to say as far as set yourself apart from others. Being a former collegiate athlete yourself, I think that's something we should highlight. I think it's something that's mapped your career to this point, and it's one of those work ethic pieces that should be a part of your story.
Sure. Well, thank you. I appreciate it. Thank you for your time. It's good to spend some time with you, and I hope we did a good one.